Welcome to our Week 11 lecture on treatment programs. So first we're going to take a look at the different treatment options that are available. And so there's obviously a lot listed here, and I'll kind of let you look through that a little more in depth. But you can see that there's a variety of programs, from detox programs to residential programs to outpatient programs and halfway homes and sober living environments, harm reduction programs, and even treatment in the criminal justice system. So these are kind of some broad examples of the different types of treatment programs that are out there, and just kind of defines them into different categories. So we're going to be looking at this idea of the continuum of care. And if this isn't an idea that you're familiar with, you're definitely going to want to become familiar with this and really understand what this concept is. The continuum of care refers to thinking of our treatment system for substance use disorders as kind of a one long continuous chain where someone is going to enter into treatment at the level that's appropriate for them at that time. And then from there, it can kind of be decided if something comes up that they need to move to a more intense level of treatment, they can move up to that. And then also, if they're progressing in their current stage of treatment, that they can also eventually move down to lesser intense levels of treatment. And that's obviously kind of the goal, right? We want people to move from the level of treatment that they're at down into where they're not needing that type of supported environment anymore. So some important things to think about when we have this continuum is that when clients are being transferred to these different levels of care, we want to make sure that that's done well, that that's successful, that there's warm handoffs, and we'll talk a little bit more about that, so that people are supported when they move to a new level of treatment. It's important to have similar treatment philosophy across those levels of care, so that there's kind of that continuity. And then efficient transfer of client records is also important, so that the information can move along with the client to these different treatment programs, and that information can be shared rather than the client having to kind of dive into it all again just because they're in a new treatment program. And so I pulled a quote that I liked. It says, "Envision admitting the client into the continuum through their program rather than admitting the client to their program." So when you're doing intakes at a treatment program, you want to think of it not just as, okay, they're coming into our program, but they're coming through this program in the continuum of care. So they're going to start here, but that's not just it. We're going to help move them along this continuum until they are in a place where they can be on their own and not needing these supportive services, or at least not at this as intensive a level. So you're kind of moving down that continuum. And the ASAM is an important part of this. If you took a look at the ASAM document that was posted on our module for last week, or if you're already familiar with the ASAM, you know that it has established 5 main levels in the continuum of care. And so that starts off with early intervention services and moves to outpatient services, and then up to intensive outpatient and partial hospitalization services, then up to residential and inpatient services, and then the highest level being medically managed intensive inpatient services. And this is all explained really well in further detail in that ASAM handout on last week's module. So I'd encourage you to kind of look through that again. And here's just another graphic describing these levels that we just talked about. So we see on the left end that it starts with early intervention and then progresses to the highest level of care, which is the medically managed intensive inpatient services. So that's just kind of a good way to show how these levels of care flow along this continuum. And so it's important to assist the client along this continuum. So as much as possible, it should be a seamless transition between the different levels of care. As the client moves either up or down to a new level of care, you as the provider may need to refer them to another treatment organization. So maybe you are working in an inpatient program and it's time for that patient to move to an outpatient program. So if your treatment organization doesn't offer an outpatient sort of program, then you might have to refer them to a different organization that is providing that service. And so it is important to keep in mind that when there's any sort of change in setting or even a change in staff that the individual is working with or the peer group that they may be with, when there's changes in those, which of course would be occurring when someone moves to a different point along the continuum of care, we do know and have to be aware of the fact that that does increase the risk of that client dropping out of treatment. So as much as possible, when someone is moving to the next step, when you're making a referral to a new program, even if it's just a change within your own program that they're in, where they're maybe working with a new counselor or going to be meeting with a different group therapy group, then you really want to make sure that there's a lot of seamless coordination around that there's a lot of case management to surround and support that person as they're shifting, because we don't want that for them to be a time when they drop out of treatment. And so we can think of the continuum of care supporting individuals along the phases of recovery. And so we can think of this as 4 different stages or phases of recovery. So that would first start with detoxification from the substance that's being used, and then that moves into an initial abstinence from the substance, and then moving more into long-term abstinence, and from there continuous recovery. And so we're going to kind of look at some of those programs that would fit in at different places along the continuum of care. And so we'll start with detoxification programs. So the goal with these sorts of programs is that you're treating acute withdrawal symptoms, so either the physical or the psychiatric issues, not necessarily focused on individual counseling at this point, but really just focusing on helping someone safely, physically, and mentally distance themselves and come off of this substance that has been used by them. So this is normally a short-term treatment, can be anywhere from maybe 3 to 14 days. There's medical professionals involved, there's substance abuse counselors involved, and this can occur in either a residential or an outpatient setting. And next we'll look at residential programs. And so these are, the goal is typically to develop stability for the individual, so at the physical, psychological, and emotional level. And it can be different lengths that these programs offer treatment for. So it might be maybe about a month, 28 to 30 days, 2 months, 3 months, and some even up to 6 months or a year. So this is typically going to involve assessments, medical care, treatment planning, individual and group counseling, community resources, case management, and also will provide a variety of different interventions in education. So it could be counseling and therapy, life skills, coping skills, exposure to the community, maybe helping assist with education or jobs. All those sorts of things might be addressed in a residential program. And we also have outpatient programs. So there's a couple different to think about, that there's kind of a more intensive level, that's intensive outpatient, and then there's a less intensive level, which is typically just referred to as outpatient. And we definitely see that reflected on the ASAM continuum of care that we look at. So the intensive is definitely more intensive, provides more services each week and more support in the program. And so with intensive outpatient, you're kind of looking at services maybe being provided 9 to 19 hours a week, where with outpatient it's going to typically be less than 9 hours a week. Again, different lengths for the programs, kind of depending on what the treatment provider has decided for how their program is going to work, or maybe depending on the funding that's available. So it might be anywhere from 3 months to a year or more. The goal here is, of course, to support recovery, and it's in a less structured environment than a residential setting. So these people are living on their own or in their own living situations rather than living in the treatment program. So it kind of gives a chance to build recovery skills with the clients in a natural environment that they are kind of used to interacting in. And of course, we know that can have its pros and cons, and so that's, of course, kind of the part where really matching someone initially in assessment, matching them to the level that they should be at, or that's most appropriate for them at the time, to figure out, can they do well in the same environment they've been in while trying to let go of the substances that they've come to use? Or do they need to be in a completely different environment, like a residential program? That might be a better fit. So with these outpatient programs, it normally is going to include, again, assessment, medical care, treatment planning, individual and group counseling, community resources, and case management, and also providing those different interventions and educations through counseling, life skills, coping skills, family and community exposure. All those different things might come up in outpatient treatment. So now that we've discussed the continuum of care and looked at treatment programs from an overall broad perspective, you can now move on to part 2, where we talk more specifically about treatment interventions.